Hello, good morning, good afternoon, good evening to everyone who's joining us from across regions and time zones, I think, yeah. We're going to start our webinar today. I'm Dr. Sutantri from the Faculty of Medicine and Health Sciences, Universitas Muhammadiyah, Yogyakarta. And it is truly a pleasure to welcome you to today's online workshop, The Role of Fathers in Supporting Mothers' Breastfeeding Journeys. This event is jointly organized by LactaHub and the Global Health Network at the University of Oxford, and we are very grateful to have you with us today. We are especially delighted because this workshop is a direct follow-up to our session at the Asia Pacific Academic Consortium for Public Health Conference in Chiang Rai, Thailand earlier this month. During that panel, we explored the broader challenge strengthening breastfeeding system from hospital to community. And one key message that emerged was the need for more comprehensive family and community support. So today's workshop takes that conversation a step further by focusing specifically on fathers, an important group whose role is often under-recognized in breastfeeding support. So we continue this discussion with deeper insight, practical strategies, and of course, perspective from different regions. And we are very grateful you are with us today. We received over 800 registration, and it's wonderful to see participants joining from so many different parts of the world. And it's also truly inspiring to witness such a global community coming together with a shared commitment to improving best breastfeeding support. So it's really heartwarming to see how global conversation this is today. So we have participants joining from more than 50 countries around the world. And on the screen, you can see the top 20 countries with the highest number of registrants, which is Kenya and until Mexico. And thank you all for being part of this truly international community. Before we begin, let me share a few quick housekeeping notes so we can all enjoy a smooth and comfortable session. First, if you have experienced technical issues such as trouble in hearing or seeing the content, please first check your device settings or close any background apps. And if the problem continues, you can exit and rejoin the Zoom room. And all participants' cameras are off and microphones are muted as well throughout the session to maintain audio quality. So please don't worry, you won't appear on any screen at any time. And if you are joining on Zoom, please, we'd love to hear from you. Please type your question in Q&A box, not in the public chat, so our team can collect and organize them from the discussion later in the session. And this workshop also being recorded. The video recording along with today's slide deck will be uploaded to LactaHub so you can revisit the content and share it with colleagues afterwards. For certificates of attendance also will be provided to participants who at least attend 80% of the session, and this will be emailed to you to your registered email address within 4 weeks. So thank you for your attention. With that, let's get started. By the end of today's workshop, we hope the participants will first understand the impact of fathers' involvement on breastfeeding, practice and outcomes, and then explore practical approach to prepare and empower fathers to support breastfeeding, and also learn from regional experience and identify opportunities to strengthen father engagement in breastfeeding support systems. We are honored to be joined by a panel of distinguished experts, each bringing a valuable perspective from healthcare research and community practice. From Switzerland, we have Dr. Devon Spica, a postdoctoral researcher at the University of Zurich. From Indonesia, we have Dr. Areta Idarto, a pediatrician and breastfeeding counselor who also plays a key role in medical education and research within the Indonesian Breastfeeding Counselor Association. From Kenya, Mr. Jesse Oyeke, a lecturer and Dean of Students at Amref International University. And from Thailand, we have Dr. Sarayorn Tonginetra. She is a pediatric cardiologist and a faculty member at Chulaborn Royal Academy. And I am delighted to be chairing today's session, and I'm sure we will gain rich insight from all of your speakers. And I will show you for today's agenda. So this is our agenda for today for 90 minutes workshop. So we will start the session by welcome and introduction, and then for 10 minutes for why breastfeeding is important. And then for the next 15 minutes, we will hear the keynote speakers from Dr. Stephen Spica about the role of fathers in supporting mothers' breastfeeding journey. And then the next 30 minutes will be continued by the expert discussion based on a question by Dr. Arita, Mr. Jesse, and Dr. Sarayorn. And then we will hear from you for the next 25 minutes. It's Q&A session, and then the last 5 minutes for key takeaways and closing. So this structure will give us a structure and also allow us to move from like foundational understanding to expert insight. And then we also going to move to engaging the session with all of you. So with that, let's move into the first part of our program, why breastfeeding is important. Before we move into the role of fathers, it is important to step back and remind ourselves why breastfeeding matters so much, not only for babies, but also for mothers and for our society as a whole. Let's start with infants, because this is where the evidence is the strongest. Breastfeeding saves lives. Breastfeeding is one of the most effective ways to protect child health globally. Research shows that breastfeeding could prevent more than 820,000 child deaths per year. Most of these deaths are caused by usually infection that breastfeeding helps prevent, especially like diarrhea or pneumonia, which remain leading causes of mortality in many regions. Breast milk provides antibodies, nutrients, immune factors that formula simply cannot replicate, and this protective effect starts from day one. In fact, even small delays in starting breastfeeding can increase infection risk. But beyond survival, breastfeeding also contributes to long-term health. Breastfeeding infants have a lower risk of childhood obesity, fewer respiratory illnesses, and fewer gastrointestinal infections as well. There is also strong evidence that breastfeeding supports cognitive development, leading to better school readiness, higher IQ scores. So these are the benefits that continue well into adolescence and adulthood. So when we invest in breastfeeding, we are investing in the foundation of lifelong health. But the benefits don't stop with babies. Breastfeeding is also a major protective factor for mothers. Breastfeeding lowered the risk of breast and ovarian cancer, two of the most common and deadly cancers affecting women worldwide. These protective effects are dose dependent, meaning that the longer a mother breastfeeds, the greater the reduction risk. And breastfeeding also reduces the risk of type 2 diabetes and hypertension, which are increasingly common and costly conditions. This chronic disease affects women's health for decades, and supporting breastfeeding is also a way to protect women's long-term well-being and quality of life. And the third dimension is the one we often forget is economic impact. According to Walters and colleagues in 2019, inadequate breastfeeding leads to over 340 billion US dollars in global economic losses every year. This is a staggering figure. Why the number is so large? Because the cost comes from several sources. The first, higher healthcare costs. When babies are not breastfed, they experience more infections and illness, meaning more hospital visits, more medications, and greater strain on health systems. So countries spend billions treating conditions that actually breastfeeding could help prevent. The second is because of the loss of future human capital. This is the biggest contributor because breastfeeding improves cognitive development. Lower breastfeeding rates lead to lower educational achievement and reduce future earnings. So, the economic impact is not only immediate, but it also affects productivity and workforce potential for decades. And the last one is because of productivity losses due to maternal illness. When mother develop illness that breastfeeding helps prevent, such as I mentioned before, breast cancer or diabetes type 2, then these costs fall on families, on workplaces, and national productivity. So when we put all this together, actually breastfeeding become much more than a health intervention. It is an economic development strategy with direct impact for national growth, for the national budgets, and also for long-term societal well-being. Next slide, please. So as we look at global data, exclusive breastfeeding rates among infants under 6 months remains at 48%, actually still slightly below the 60% target for 2030. And this shortfall is not because mothers lack of motivations. It's because they face multiple interconnected barriers that no mother can overcome alone. The literature shows that this barrier occur at different levels. The first, healthcare barriers. Many mothers report receiving inconsistent guidance from health professionals, such as being told that supplement with formula unnecessarily or receiving conflicting message between antenatal and postnatal care. This inconsistency undermines mothers' confidence at a very vulnerable moment. Second, sociocultural barriers. Deeply rooted norms can make breastfeeding also difficult. For instance, in some communities, mothers experience family pressures to give water or maybe sometimes herbal drink early because elders believe that breast milk alone is not enough, despite evidence actually showing otherwise. And the third is sociocultural barriers. Returning to work is one of the biggest disruptor of breastfeeding as well. So the review highlights examples such as lack of private space for pumping or inflexible schedule at work, which force mothers to shorten breastfeeding earlier than planned. So that's also become one of the barriers, major barriers actually for the woman to continue breastfeeding. And the last one is personal barriers. This include maternal exhaustions like pain and also the perception that I don't have enough milk for my baby, something like that. Many women in the studies also describe the feeling of like feeling overwhelmed, unsupported, which directly impacts their breastfeeding success. So when we put this together, it becomes clear. Breastfeeding is not an individual task. It's not only the job of the mothers, but it requires a supportive system around the mothers. And this leads us to the next point, why fathers matters. Fathers play a very important role in helping mothers to navigate these barriers, emotionally, physically, socially, and this sets the foundation for our conversation today. How can we meaningfully engage fathers to support mothers' breastfeeding journeys? With that context in mind, it is my pleasure to introduce you to our keynote speaker who will dive deeper into the role of fathers in supporting mothers' breastfeeding journeys. Our keynote speaker today is Dr. Devon Spica, a postdoctoral researcher in economics at the University of Zurich, affiliated with the Larson Rosenquist Foundation Center for Economics of Breastfeeding, and her work focuses on how early life experiences, including breastfeeding, shape later life outcomes and what drives parents' decision about investing in children. We are honored to have her with us today. So, Dr. Spica, the floor is yours.
Thank you so much, Dr. Sutantri, for this introduction and for providing such a nice overview of why breastfeeding is so important, and then also setting the scene for why engaging fathers is critical. Uh-oh. There we go. So, why is involving fathers important? Well, as Dr. Sutantri pointed out, fathers are a key part of the support system that's around mothers when their babies are young and in general within the family. And the decision to breastfeed is not made in a vacuum. It's made usually alongside many other members of the household. And in some cultures, the fathers might be the primary decision makers. They might be the ones who have the final say about whether or not a mother breastfeeds, for how long, when she introduces other foods. So it's really important to have them on board and to provide them with the knowledge necessary for them to be making informed decisions about their infant's nutrition. So how might fathers be influencing breastfeeding decisions? Well, As I mentioned, they are a key part of the support system surrounding a breastfeeding mother. And they might provide practical support in terms of doing household chores, helping care for other children, preparing meals, etc. They might provide emotional support. So, by being there while a mother is breastfeeding, by providing encouragement. And they might also be providers of financial support. So, especially in settings where there's limited access to parental leave, it really might be the fathers who are the key breadwinners within the family while an infant is young. Yeah. Fathers might also influence breastfeeding decisions through their attitudes, their knowledge, and their beliefs. Because, as I mentioned previously, often the decision to breastfeed is not made by the mother alone. It's made by other people within the household, including the fathers. So their attitudes towards breastfeeding, their knowledge of breastfeeding and how to practically support mothers is going to be important. And indeed, descriptive studies that have investigated this find that when fathers have more positive attitudes towards breastfeeding, mothers are more likely to breastfeed. Moreover, when fathers have more positive beliefs towards breastfeeding, mothers have greater intentions to breastfeed. So they're more likely to intend to breastfeed and intend to breastfeed for longer. So these attitudes, knowledge, and beliefs can directly affect the breastfeeding decision, but they can also work through the amount of support that fathers end up giving. Because we can imagine that when a father is more positive towards breastfeeding and values it and has stronger beliefs in the positive returns further down the line to a mother breastfeeding that infant, they might be more likely to go out of their way to provide the practical, financial, and emotional support that a mother might need. And then all these decisions are happening within a broader context that I think is really important not to forget. Because the institutions at play in one setting versus another can be very different. And they might affect then the attitudes, knowledge, and beliefs that fathers have, and also the extent to which they're able to provide support. For instance, in a setting where fathers are very much included in the antenatal care that mothers receive, they might just be privy to far more knowledge about breastfeeding and how to support their partners compared to a setting where fathers are not included within the antenatal care that a mother receives. Additionally, in a country with good access to parental leave, for instance, in Sweden, where both fathers and mothers are entitled to parental leave and are allowed to split that leave however they want, fathers might be much more able to provide the practical support that mothers need, and they might be less needed as a provider of financial support, which might then free up more time for them to engage on the practical side and the emotional side. Of note, in Sweden, keeping with that example, actually fathers and mothers are entitled to 30 days in which they're allowed to take leave together. And as to the extent of my knowledge, nobody has investigated the extent to which that this being allowed to take parental leave together has an impact on breastfeeding decisions. But I would imagine that especially in those early days, the chance for both the father and the mother to be off might really play into this breastfeeding decision, given the fact that it really allows fathers to be there and provide the support that the mothers might need. And then all of this happens within the even greater context of norms, especially if we think about gender norms. They might influence the institutions in place. They might influence the extent to which fathers are provided with knowledge about breastfeeding. So I think it's really important to also just take a step back and think about kind of what are the bigger picture things, bigger picture norms that are at play and might also be influencing the extent to which fathers kind of can step in and support mothers. So now, what evidence is there on involving fathers in breastfeeding. We've talked about kind of how they might be important for the breastfeeding decision, but now what happens when we do intervene and engage them? So there's a limited but growing evidence base on father-inclusive breastfeeding interventions. And the key targeted pathway of these interventions is education. So the idea is if we educate these fathers, we can change potentially their attitudes, their knowledge, and their beliefs, which might then have an effect on the support that they're able to provide to their partners. Both experimental and quasi-experimental studies have been conducted so far in several countries around the world. And taken as a whole, the broad conclusion that we can draw is that breastfeeding education that targets fathers or fathers and mothers together is effective in increasing breastfeeding initiation, including the early initiation of breastfeeding, breastfeeding duration, and exclusivity. These interventions have also been successful in increasing mothers' perceptions of the father's support, which one can imagine is quite important in terms of reducing maternal stress. And then they've also been effective in improving fathers' attitudes towards breastfeeding. One thing to bear in mind with these studies is, however, that there's quite a bit of heterogeneity in the interventions that have been conducted so far. There's heterogeneity both in terms of where in the world that they've been conducted, but also in terms of what the interventions themselves involved. Was it face-to-face or was it online? Was it group-based support? Was it one-on-one, etc.? And then there is also, kind of on the measurement side of things, some heterogeneity in the outcomes that the researchers have investigated. So more research is definitely needed to identify the most effective way of including fathers. But we can, I think, already conclude now, based on the literature, that there are some key characteristics of effective interventions. And those involve the provision of support during the antenatal and or postnatal period, the provision of face-to-face support, and that this support is provided by trained professional or lay supporters. But importantly, they're trained somehow. And then moving forward, there's definitely still this need to identify kind of the optimal ways of including fathers and ways of increasing their engagement. For instance, now we know with these studies that if we improve fathers' knowledge, this has an impact on breastfeeding behaviors. But how do we really get those fathers involved? Kind of, if we take a step back, how can we do that? And then also there's definitely scope for exploring the use of e-technologies like SMS or app-based services, or for instance, WhatsApp groups for including fathers. So to further kind of explore this question of what's the best way to involve fathers, we recently, with the Center for Economics of Breastfeeding at the University of Zurich Department of Economics, we recently conducted some exploratory focus group discussions among fathers, mothers, and community health workers in the Dar es Salaam and Pwani regions of Tanzania. And these are very much to inform a broader research agenda within early child development that we have ongoing there. And today I would like to talk a little bit about some of the findings from these focus group discussions. But I do think that all of these should definitely be taken with a grain of salt, because these are based on 2 focus groups among fathers, more among the mothers and the community health workers, with 8 participants each. So it's a small sample, but I think they do really highlight some of the things that are important to think about when trying to engage fathers. So our goal with these focus groups was to understand where fathers are getting information about infant nutrition, what their knowledge is, how they view their role in infant feeding, what barriers they perceive to involvement in infant feeding, and then also what trade-offs they face. Because as economists, we're kind of interested in that decision, like what are they weighing up against, if they're going to engage with their infants, what's the counterbalance. And then we also talked a little bit with them about what kind of intervention might best support them. So in terms of knowledge, we found that many of the fathers did seem to have good knowledge of the WHO recommendation to exclusively breastfeed infants below the age of 6 months. But none of these fathers had been targeted directly with infant feeding information, and they would only receive it if they attended their antenatal care clinic visits. And importantly, in this community, there are two important barriers to attending those visits. And one is that they involve mandatory HIV testing, which some fathers are not so keen on and therefore don't attend. And then also, the families that we spoke to are quite financially constrained. So in these cases, a father might be weighing up, do I go and work for an hour and potentially earn some money, or do I attend this antenatal visit with my partner? But something important to note is that all fathers we spoke to, they did want training on how to care for their infants. And I think this is reflected in the literature from other settings as well. And one thing that really came out is that they would like to have group discussions so that they could learn from other fathers within the community, because this would allow for a nice opportunity for idea exchange. And then they also had some other proposals for how they might be engaged, but really this group setting was something that came out a lot. And then we asked them a little bit about how they viewed their roles as fathers. And in this case, they viewed a good father as somebody who takes good care of their family. And when we asked them what kind of support that they provided for their breastfeeding partners, the most common form of support that they mentioned was financial. And they really saw this financial support as a way of, they were the providers, they put food on the table to ensure that their partner was well fed and was then successful in breastfeeding. Some fathers also mentioned providing practical support like cooking or feeding the baby, as well as emotional support. But importantly, within these communities, there exists a big barrier to fathers engaging too much in caregiving activities. And this was restrictive beliefs related to gender norms. And so nearly all of the fathers we spoke to, and this has come up in other qualitative research with fathers in Tanzania, spoke about this fear that, or this belief that fathers who engage too much in caregiving activities are potentially bewitched or controlled by their wives. So in order to not be a source of gossip within the community, fathers might only help out behind closed doors, or and for instance, not go with their wives to visit the clinic. So I think this really highlights the need when designing policies or interventions to involve fathers to really think about the cultural context at play as well. Because in a setting like this, it might not be enough to just give fathers knowledge about how they can support or about the importance of breastfeeding. It might be important to also come in and think about trying to change those gender norms. And then finally, in terms of how the fathers would like to be engaged, role models were mentioned, but then group trainings were really highlighted as a key way they would like to be engaged. And something important that came out here, and I think is relevant for everyone here today, is they talked about us going to places where men gather. And this raises kind of the convenience issue, and then also a selection issue. So if you only target fathers who are coming to the clinic visits, you might only be reaching a selected group of fathers. Whereas if you go to some of these other venues that men might be gathering, you could maybe reach a group of fathers who you might not otherwise have been able to reach. So I think that's something important to bear in mind, like where is the best setting to target these interventions? And then something that also came up was the provision of some form of compensation for the lost work time. Because if we think of inviting fathers to some kind of training that takes an afternoon, that might be an afternoon that they're forced to be away from work. and therefore not earning. I think it's also important to think about kind of the optimal way of engaging these fathers so that it's as easy as possible to engage them essentially and involves as few trade-offs as possible in terms of, for instance, lost earnings. So in terms of conclusions from these focus groups, a key takeaway is that the fathers we spoke to, they want to be involved, they want to be trained. One thing to note, as I mentioned before, this is a small number of fathers we spoke to, and it's potentially a selected group. They're fathers who are willing to come to a focus group discussion on fathers and breastfeeding. But amongst these people, there was a desire for training and information, but they did face some key barriers, and those were financial and time constraints and the prescriptive gender norms I spoke of. So in terms of financial and time constraints, I think this is something that we as economists can kind of really contribute here, because we can try to answer the questions of, okay, well, what happens if we initiate some institutional change? What happens if we relax the constraints that these fathers are facing? For instance, what happens if we provide families with an unconditional transfer, cash transfer? What happens to fathers' engagement then? And then this might feed into a discussion about, for instance, more generous parental leave policies. And then with regards to prescriptive gender norms, as I already said, it really highlights the importance of thinking about culturally appropriate interventions and really thinking about the context that one is operating in when designing policies. And then we can take that step back and start to think about, okay, well, how maybe can we change these norms? And there we might think about role models. If we select a few fathers in the community who are kind of really good at supporting their wives in breastfeeding, think of them as champion fathers. What happens then? Mass media campaigns. And then something that economists have recently become quite interested in is this idea of belief correction. So maybe it's the case that in these communities, that people hold incorrect beliefs. So maybe everyone in the community thinks that they will be stigmatized or judged for engaging too much in caregiving for their family, but maybe they wouldn't be. So maybe if we were just to go out and gather information on the extent to which they would be gossiped about or stigmatized for that behavior, and then if we maybe just provided that information to fathers in these communities, that alone might be able to lead to behavior change, leading to better infant nutrition outcomes. So I'm going to leave it at that for now. If you have any thoughts or questions, feel free to reach out. And I'm really looking forward to hearing what the panelists have to say next.
Thank you, Dr. Devan Spika, for your insightful presentation. And actually, from your presentation, you clearly mentioned that actually fathers are not only the supporters in the background, but they are actually the key actors whose knowledge, whose attitudes, whose everyday action can shape the breastfeeding outcomes. So your example also reminds us that many fathers actually wanted to be involved in the breastfeeding journey, but they're often held back by limited information or like what you mentioned, strong gender norms that held them back, and also practical time constraints for them. But at the same time, your finding also gives us hope that with the right training, with the community engagement and supportive system, fathers can become a powerful partners actually in the breastfeeding journey. So thank you very much for grounding our discussion in both evidence and also for the real life voices from your FGDs. Really, really insightful and really, really nice. So with that, we now move into our panel discussion. Uh, where we will hear how this insight on father involvement translate into the real practice across different country contexts. And here I'm very pleased to be joined by three wonderful experts that I have already introduced as well in the beginning. I have Dr. Areta Idarto from Indonesia. Hello. And I have Mr. Jesse Oyeke from Kenya. Hello, Jesse. Yeah. And also have Dr. Sarayorn Tonginatra from Thailand. Hello, Dr. Sarayorn. Yeah.
Hello.
So, yeah. Thank you for all of you for being with us today and for your willingness to share your experience with all the audience participants of our workshop. We're really looking forward to this conversation. So before we already listen to Dr. Devan presentation, but now we're gonna start with some question, big picture. Actually, uh, Dr. Devan already mentioned in her presentation that breastfeeding, the involvement of father in breastfeeding can improve the initiation, duration, and the exclusive breastfeeding of the mothers. But I want to ask three of you, like all of you, how does father's involvement affect breastfeeding initiation and duration in your context? Because you're from Indonesia, Kenya, and from Thailand. What have you observed in your countries or your community? So I want to hear from three of you. Maybe we can start from Dr. Arita first this time. Yeah, please.
Thank you, Dr. Tantri. Hello, everyone. From Indonesia here, same as Dr. Tantri. So, in today's world, I think we all agree that when information moves faster than truth, now families often like navigate breastfeeding through a blend of modern advices and also balancing it with the long-held cultural practices. And during my roles as clinicians, as breastfeeding counselors, and also educator, we tend to see and we like to see it not as a barrier but an opportunity to strengthen breastfeeding by inviting fathers because men likes to be invited. They don't get the invitation, so we send them the invitation so that they can jump in and have a role that aligns very deeply with our values of family unity because I think Sarah will also agree because we are from Southeast Asian countries where values in the families unity matters. And so we can conclude that it is a shared responsibility. And I think one point is consistent with what was mentioned by Dr. Devon that when fathers are informed, involved, I think breastfeeding initiation rises, exclusivity improves, and duration also increases because emotional reassurance to mothers are important and it is interconnected. If I may share, in Indonesia, we are an archipelago country. We have 17,000 islands, a very extraordinary diversity with lots of ethnic groups. So I cannot really voice out for one ethnics. But one thing for sure, fatherhood looks different in every region. And in our culture in general, eastern part of Indonesia, extended kinship means like caregiving is shared. So not the father roles, but the mother-in-laws or the grandmas may be more dominant in many communities. So I think in for example in Japanese family, fathers show love by providing stability. That's how they express their love. So when they are not informed, they will not be able to contribute. So I would agree that with this diverse culture, when they are allowed and then invited to contribute in meaningful ways with the right clear guidance, because sometimes they want to help, but they don't know how. So I think the roles of education, informations truly matters in this part.
Thank you, Dr. Arita, for your explanation. Very clear points from Indonesian perspective. So now I want to hear from Kenya. Jesse, how does this resonate in the Kenyan context?
Thank you very much. And from the Kenyan context, it actually resonates with what Dr. Devon has just spoken about, because the research was done in Tanzania, which is just a border country bordering Kenya on the southern side. And some of the issues that were raised actually resonate with what happens in Kenya as well. Further saying that they don't get training is actually true because most of our gender norms define that breastfeeding is mainly considered a woman's role. And therefore, rarely do you find fathers getting involved so much in terms of supporting breastfeeding. However, when they're involved, we've actually seen studies that show that there's early initiation, increased duration, as well as exclusivity, just similar to what Dr. Devon spoke about. Um, the way fathers would really get involved is changing their attitudes. If they're well informed, then they're able to support breastfeeding. Um, when they understand the benefits of breastfeeding, both to the infant and to their partners, then they're able to really support breastfeeding, even when there are challenges. So the husband can also counter, family and workplace pressure. Uh, Dr. Rita has mentioned the issue to do with kinship. You know, mothers-in-law, relatives, older women would come and say, "This baby is hungry. You need to give the baby porridge for example." But a father's voice is very important in our cultures. So if a father understands why we need to, breastfeed exclusively, then they're able to counter some of that pressure and offer support to the mother. Thank you.
Thank you, Jesse, for your insight from Kenyan perspective. So it's actually almost resonates what happen in Indonesia as well. Like in Indonesia, we are collectivist country, so everyone want to be part of it. Actually, not only the father, but also the grandmother, like maybe the auntie, the uncle. So everybody wants to have a voice actually in the breastfeeding journey. So now we want to hear from Thailand. What does this look like in Thailand, Dr. Sarayon?
Yes, from a Thai family, especially in the rural area, we still practice male breadwinner as model as well. And infant feeding and household work are often perceived as mother's duties. And also you mentioned about extended family. In Thailand, many family right now are nuclear family, only the father, mother, and the kids. But one thing that usually happen when after childbirth, sometimes it's very common for them to stay with or invite the grandmother to help taking care of the baby. So in this situation, many grandmother have influence on how the family taking care of the baby or decision on continue breastfeeding as well. So I think father play an important role in supporting the mother, and but one extended family like grandmother also have much influence in Thai culture as well. Yes.
And sometimes grandmother has bigger influence than the father, isn't that correct?
Correct. You're right.
Yeah. Okay, same things, yeah, like Indonesia. Okay, thank you very much. Wonderful perspective from all of you, three of you. So let's move to the next theme. So we mentioned in the early days of or weeks after birth, mothers sometimes still like feeling needs the most support at that time because they don't know with all the changing that happen in the bodies with the like the sleep and everything, lack of sleep. So what effective ways actually have you seen fathers supporting mothers both emotionally and practically during this critical period of time? So before we start with Dr. Aritano, we start from Jesse, perhaps this time with you.
Yeah, thank you. What are the practical ways? Maybe I'll mention just one, and my colleagues will expand on the rest. But one, well, the practical support can be emotional as well as physical support. But I think the emotional support is actually, well, we really can't rank them, but it's quite important that when mothers are almost giving up, because from experience, breastfeeding can be tiring, especially in the first few months. When you're doing exclusive breastfeeding, it can be tiring. And therefore, a father who offers support and encouragement can help to raise the mother's confidence and help encourage the mother to breastfeed. Uh, especially when you talk about exclusivity of breastfeeding, when we want to feed our babies for 6 months, towards the end, you find that the baby needs more and more food. Maybe the mother is not producing enough milk. But just a father coming in and saying, I know it's difficult, but we can continue until 6 months. That's quite important because it then gives the mother the confidence and helps to encourage the mother to carry on breastfeeding until the 6 months are over. Then we can now start weaning. So that emotional support and confidence building is very, very important, which fathers can do. I know they can also do practical things, and possibly I'll let my colleagues chip in on the practical aspects. Thank you.
Thank you. So two most important thing is emotional support and confidence building from Jesse. So maybe that's a very concrete example actually. So now, Dr. Sarayon, maybe how do fathers contribute in the Thai context during this critical period of time?
Yes. As same as Devon, she mentioned about three components: emotional support, practical support, and financial support. But for me, between emotional and practical support, I feel that the mother prefer emotional support. Many mothers just when they come to a breastfeeding clinic, they mention that they just want the father just to be there. Sometimes they when they have the breast problem, they told me that they want the father to come and know how pain she got from the mastitis, from the blocked milk ducts. So many mothers mentioned that they just want the father to be there. That's kind of emotional support. And the practical support that I see in the success for breastfeeding family is that the father usually involved in taking care of the baby. They know how to hold the baby. They know how to change the diaper or taking over of the other household tasks. Like they can help mother to prepare the express meal or help cleaning in the bottle. So I think both emotional support and practical support are essential.
Okay, thank you very
Thank
much.
you.
So that's really helpful as well. Dr. Arita, anything you'd like to add from Indonesia?
Oh, from Indonesia specifically, I think
Yes.
not much of a difference, but I think early days, sometimes mothers don't need grand gestures. Just like a simple line of, we're in this together, you are not alone, I'm here for you. Sometimes those simple lines are more than enough to reassure mothers that they're not alone, because sometimes they feel alone because it's like an intimate, we see that as an intimate session between mothers and baby. And sometimes fathers feel like, feel like left out and don't know how what to do other than the non-feeding task. However, those simple lines can actually add up to it, and this emotionally calm situations, clarity, stability. I think that will help more than enough to mothers and babies.
Okay, it doesn't need grand gestures. That's from Dr. Arita. But yeah, small things counts actually during this period, especially the emotional support from fathers. Yeah, like compliments. Sometimes, yeah, because mothers during that period sometimes also feel insecure as well with the changing of the body. So like kind of like the compliment actually kind of stuff also means a lot for the mother. So
If I may just
let
add, sorry,
yes,
sorry.
please, Desi.
If
Yeah.
I may just add and probably share my experience. I remember when we had our firstborn, and well, I used to, change diapers, bath the baby. But there was one thing that I never knew was really important is, washing the bottles. Um, and one day my wife told me, it could really help if you wash the bottles. And that completely changed everything. I mean, she was really grateful because, it takes a lot of energy and strength. And, a mother being able to breastfeed every 3 hours, they get really tired. And it's just that small thing. As Dr. Isa has mentioned, they don't need grand gestures, but it's just that small thing that would really make a difference. Fathers can also help, at night when the baby keeps waking up, you can alternate so that at least someone gets to sleep longer. If the mother is expressing the milk, you can alternate. I'll wake up in the next 3 hours, feed the baby, wrap the baby, change the baby, put the baby back to sleep. So the mother can get enough time to rest so that the next time the baby wakes up, then the mother takes over. So it's those small gestures that can really make a difference.
Yeah, that's amazing. Yeah. Small gestures means a lot. Yeah. Okay, so now let's move at the role of culture. I remember on our panel at Chiangre at that time, we mentioned we learned from Dr. Sarayon, and there is a specific culture in Thai that usually the grandmother or like for the baby, they will give like the water for the baby. That's why the exclusive breastfeeding rates under 6 months is very low in Thailand. So I want to know more actually about this kind of culture as well in your region. What cultural belief or social norms influence fathers' involvement in breastfeeding, and are these norms helpful or this is limiting? Can be good or it can be negative. So maybe we can start from Dr. Sarayon this time.
Okay, so the misconception about breastfeeding is giving some water for the baby. So they believe that it would help to clean the mouth of the baby. So this thing is for the healthcare professional. We try to fight with this, but sometimes, as I mentioned, the grandmother, they do not um, access the new knowledge about pre-lactal feed that it should not give to the baby. So this thing is quite important. So right now, nowadays, we give the knowledge to the mother, and sometimes as well in the clinic, I found that the mother has some conflict with the grandmother, and it would be more serious if it's a grandmother-in-law,
Mhm.
because the grandmother-in-law might be have more influence on how mother practice with the baby. So sometimes I would like in my practice I invite all the family member to discuss in the same place, so we can give the information at one time, that and mother would get more support from the healthcare professional, that okay, water, banana is not allowed in kid under 6 months old. Yes, that our barriers as well.
Oh, you want to elaborate more on like, is there any misconception as well, or social norm, or maybe gender norms that also, like makes become the barriers of the fathers to be involved in the breastfeeding, like to help the mother to breastfeed? Maybe because I'm a man, not my responsibility. Is there any belief or culture like that in Thailand, Dr. Sarayor?
Right, it's the same. So yes, I think it's the same as Indonesia, that the father do not much involved in breastfeeding, because they think that that's woman's duty, and maybe they leave this responsibility to the grandmother, the mother instead. So many men do not involve. But nowadays in the urban area, I found that many father has more knowledge about breastfeeding, and sometimes in the service, they come and discuss about what side of the French I should use, if I would like to help the mother to express their milk, or how can I hold, they ask, how can I hold the baby? But this is a
Mhm.
gap. I mean,
Mhm.
they have the willing to help, but they are not know exactly
Mhm.
what's their
Wow.
roles in helping,
Wow.
how to help the mother.
Yeah.
So nowadays, father are invited to come to the, we call father and mother school before in an antenatal care, but many father cannot involve, maybe because of their job commitment. They have their work commitment and they cannot come. So paternity leave would reduce this barrier, in my opinion.
Paternity leaves. Okay, longer paternity leave. Yeah. Okay, now from Indonesia, Dr. Arita, maybe you want to also chip in on this?
Yes, Dr. Tantri. I think with Indonesian, we see a similar dynamics with Thailand, like the bananas stories and also the water stories. And also, if I may add, they can see that colostrum is considered dirty, so needs to be discarded. Um, Also, they're adding honey or herbal drinks or whatsoever. However, we now tend to approach this in a different direction. We do not want to create cultural conflicts. So, yes, I agree, cultural norms do affect father involvement because Indonesian fathers may feel it's not their place to speak in front of elders. In this case, their mothers or their mother-in-laws, they feel like they are the infant expert. They think that what they need to do is provide financially, and then caregiving is assigned to women. But the good news is, I want to highlight this, that when fathers receive clear roles, simple tasks that they can do, and practical guidance, I think they can actually participate confidently even within those traditional structures. Nowadays, I think we see that on the contrary, modern Indonesian fathers are not thriving. They have role models. They see more fathers wanting to be hands-on, participating, for example, skin to skin, and they see that as like celebrity dads or parenting influencers. They see this as a positive influence, and they can model that and they can copy that, and they can actually step into that role with pride, without citing the traditional norms that can limit it. But this growing movement, I think we should really appreciate that they are eager and more confident to be involved. So what makes it different is the access is clear and evidence-based information is being provided, that hence create a change in perception, change in attitude, and then finally change in behavior. So I think that would be one of the key things that we also play roles in it. Information.
That's great. So the role of actually social media as well in promoting this kind of influence, it's bring positive result as well, Dr. Arita. Thank you. So from Kenya, maybe you have some experience to share, Jesse.
Yeah, it's not very different from what is happening in Southeast Asia because, as my colleagues have mentioned, breastfeeding is seen as a woman's role in most of our communities. Kenya is a country with over 50 different tribes, and each of these tribes have their different ways of dealing with some of the issues. But more so in rural communities is where culture is quite pervasive, especially looking at breastfeeding mainly from a woman's role and responsibility, and therefore men rarely are engaged. But if you go to the urban centers, just the same that happens in other places. You find that men are actually more involved. The other thing that also resonates with what happens in Thailand is grandmothers often have a lot of power, over how the baby is raised, as opposed to a man, he'll feel that it's not his place to contradict or to speak up against something that he feels is not going on well in terms of infant feeding. So a man would rather keep quiet than contradict their mother or their mother-in-law, especially when it comes to infant feeding. So in the rural areas, culture is still quite strong, and most of these gender norms traditionally have inhibited, early initiation and exclusive breastfeeding. But when you move to the urban areas, things are changing a bit.
Thank you, Jesse. So it's gender norm. It resonates actually what the presentation from Dr. Devon previously. Gender norm actually one of the barrier for the father to be involved in the breastfeeding journey. Okay, thank you very much, Dr. Arita, Jessie, Dr. Sarayon for such rich and thoughtful reflection. And due to time constraint, we need to stop the panel session now. But we will continue to the Q&A. So we will give you more questions actually after this because we already received so many questions from the participants, and we want to hear their question and we want to know your answer after this. But thank you very much. We need to close this panel session for now. And I can conclude that from your explanation, three of you, like it's really clear that father engagement in breastfeeding is actually shaped not only by individual willingness, but also it's influenced by the culture, by the community expectation, like, and also workplace realities as well. So at the same time, also your insight have reminded us as well that there is so much opportunity actually how to strengthen the role of the father, how to support the mothers actually through intentional and father inclusive approach. So there are opportunity, and also from the Dr. Devon before that, yeah, with structured training, actually father really willing to participate or to support the mother's breastfeeding journey. So thank you very much for your all the panel session for this time. So we will now move into the Q&A session. So I warmly invite our participants to submit your question in the Q&A box. And yeah, our team already collected actually. We got so many questions. So I will start right away with the first question that we have received here. The first question is from Francis Nyomo, but we don't know where Francis from. Hello, Francis. So Francis asked, how do you ensure fathers get engaged in supporting breastfeeding mothers if the father is working or engaged somewhere else? Like sometimes it's become trend like long distance marriage or long distance, like relationship. So the mother is here, the father is over there. How the father can be involved if the distance become the issue here? Uh, Anybody want to start this to answer this question? Maybe from Jesse?
Yeah, that can be a challenge, to be honest. And if you look at some of the traditional African norms, in some communities, actually, whenever a woman gave birth, then she was not, allowed, the husband was not allowed to see her for a period of time. And that actually creates a barrier. Even if the man would like to get engaged, because of that, they're not able to get engaged and support the woman. But if in such a situation, if the father is far away, emotional support would still be important. Just giving a call and listening to the challenges. And sometimes, as men, we like to give solutions. And yet, at times, the women don't even need a solution. They just want you to listen. So by just being available, you can call, you can speak, and encourage the woman, even if you're far from her physically. There's still some emotional support that you're able to give, and that can help to promote breastfeeding.
Mhm. Thank you, Jesse. Maybe Dr. Devon want to add to this answer. Yeah.
No, I think I agree with Jesse, what Jesse said. Just that it would seem to me that it's kind of the emotional support that they're able to provide that would end up being quite important. And then obviously like financial support if they're away, if they're the ones earning. But yeah.
Okay. Any other answer maybe from Dr. Sarayon or Dr. Arita want to add? Any additional?
Yes, I have one
Yeah.
case.
Yeah.
They had a breast feeding problem. The colic and overfeeding when they was young. The father and mother lived together in Bangkok, and after a month, the mother need to move to Indonesia. But the father based in Thailand in Bangkok. So what they did is they do the video call every day. They see each other maybe a couple months each time when the mother fly from Indonesia back to Bangkok. But they do a video call, and I think this helped. And when I found the baby in the clinic, when the baby come back from Indonesia to Bangkok, the baby engaged with his father. It's quite interesting. They don't see a face-to-face each other quite often, but a video call would help they connect to each other. And the mother mentioned that the emotional support is more important for her because she has a nanny in Indonesia who can taking care of the baby. But when she feel insecure or she needs someone who listen to her, she do a video call to her husband in Bangkok. So that's an example for my case.
That's a real case, yeah. Yeah, and then actually it circle back to the previous answer from Dr. Arita. It doesn't need grand gestures, like just listen. It's already means a lot for them. And also now with the help of the technology, as you mentioned, with the video call, also it really helps actually with the to communicate, yeah, between the partners with the partners. Okay, we're gonna continue for the next question, and it actually is still almost similar but a bit different. So this question is from Rafael Maikwenda. How do we promote partners or father support in single mothers or adolescent mothers who are not married? So there we have many cases like this as well. How we do this in this case? Who want to start this time? Maybe from Dr. Arita first.
Okay. Maybe others can chip in. Well, thank you for raising this. It reflects a very real and sensitive situation that many of us encounter in practice. Really, I mean, a young woman, especially teenagers, become pregnant and then maybe delivers outside of marriage. It is a breastfeeding challenge, and breastfeeding challenge is not biological in this case. So teen mothers are actually fully capable of producing milk and breastfeeding effectively. The challenge is almost entirely psychosocial. As a part of the Indonesian Breastfeeding Counselor Association, we often face this, and we haven't come up with a better ways apart from mm, to protect. So what they need is protection, protection from judgment, protection from misinformation, even for single mothers as well, and protection from, most importantly, emotional overload. If we are saying that, yes, fathers also part of that emotional support, but we ensure them that the support doesn't always come from partners in this case, because the situation may be different. But that does not mean they cannot breastfeed. So with the right support, many do extremely well. Although we have to admit that the key thing would be the age and the marital status that make her decide not to be successful in breastfeeding. So we need to help mothers to decide what's best for their situation. And sometimes this ability is limited and defined by judgment. And then I think that's where we should be their friends, to side with them, to try to ease the stressors. Once we have a 15 years old mothers, they no, she felt that she was feeling more powerful than ever because she feels that she's not alone, she's fully supported, even without a husband, without a father. And most importantly, what I remember, she did say that I feel like I'm surrounded by compassion, and that should help me get through life with my child because of the support that I receive, because of the compassion that I have received. I think that's also our role as community, regardless of our background, to be kind.
To be kind, yeah. Thank you, Dr. Arita. Maybe Dr. Devon want to add?
Yeah, no, I think that's, I really liked your thoughts, Dr. Arita. And then I think in general, I think this is a setting or a situation where probably the context really is important. In some cultural contexts, you might have multi-generational households living together. There's potentially less of a stigma around having a child outside of marriage, and you maybe have a better support system around. But then in some settings, maybe there's more stigma. Maybe these mothers are alone. And I think it's really them who potentially kind of need the greatest amount of external support. given that I'm not a practitioner, I'm not so sure of like the best ways to provide that support. I really liked what Dr. Areta spoke of. But I think I just think that this is something that will differ in a lot of different contexts around the world as well.
Yeah, exactly. You want to add, Jessie? This? No, enough? Yeah, this?
I think Dr. Rita and Dr. Devon have actually covered it. This is a socioeconomic issue,
Yeah.
but beyond the fact that this is a single parent, still, they can still get support from the family members. If the father of this young lady comes out strongly to support the breastfeeding journey, then it actually makes quite a big difference.
Yeah, exactly. Sarayur?
In Thai context, many single mother or teenager mother, they may stay with their extended family. That means they have grandmother, grandfather, or aunt, uncle to help with them. They usually, most of them do not usually live alone. So this for the extended family may help to support the single mother or teenager mother. And the other thing is that nowadays, in some school or university, they do allow the mother to leave to do the express their milk in school or in university. So this help to promote breastfeeding in student as well.
Okay, thank you. So I have the next question. So this one is anonymous. So, is there any evidence wherein fathers can relate more to other experienced father as speaker instead of women or mothers? I'm just curious which approach is more effective, since in my country it's really hard to convince fathers and make them listen. So anybody wants to start with this one?
I mean, I
Yeah,
can jump in.
Yeah.
And I'm not aware of evidence. There might very well be evidence on this. I haven't looked. But what I did want to say was that just in speaking to fathers, it really seems like having a father as a role model is probably very important for them. So somebody who can identify with them and understand kind of the different constraints that they might be facing, and really help share what their role might be, and understand them. So if you have a woman come in, it might be different. They might feel like she doesn't fully understand kind of the challenges that they might be facing. So I imagine there's probably evidence on this, but I would have to go to the literature and look. But I would be curious whether the other panelists have kind of experiences with this in practice.
I'm actually curious. I want to follow up this question as well. So, based on your work, like, what do the first-time fathers usually need most when supporting breastfeeding? Is it like they need the information aspect or the confidence, or they need role model? So, what they need actually for the first timer, like the first-time fathers usually need. Uh, want to start, Jessie? Maybe?
Well, I don't think there's a preference or categorization of what they need most. I think they actually need information, first of all, knowledge on why breastfeeding is important, exclusive breastfeeding for that matter. Um, Once they get that information, then in their own way, if there's someone who can role model and show them that they're not alone, and as Dr. Devon has mentioned, at times from a male perspective, if a fellow man is actually telling you that this is what you need to do, they are open to listen, especially from a cultural perspective. They're open to listening and following what they're being told from another man. So that modeling is also very, very important apart from the information. Yeah.
Role modeling. So it's actually three of them the same importance. Information importance, confidence important, role model also importance. Somebody else want to add? Just one more speaker, maybe? Yeah, Dr.
I
Arita?
want to share, Dr. Tantri, that I think you've heard in Indonesia, we have this community called Ayah Asi that translates with what? Asi is breast milk, Ayah is father in Indonesian. So this community shared and exchange experiences, even some funny stories between like guy to guy talk, like father to father talk. But this is a very informal settings. But I think the latter, the ambience is broad, not like with data, numbers, studies. I think they engage better because I believe fathers also face the same stress um, as with mothers. Not to mention in like quote unquote modern family, they don't have extended family to discuss this new experience with. And now Indonesian like going to social media for information. That's why we're saying providing accurate, reliable resources of information is very crucial because they watch videos from social media, they take information from social medias, and they promote communities from social medias in Indonesia. So I think this is a very good start that the sta- the labeling of patriarchy roles in Indonesia has actually shifted. More males and more fathers are being aware, and they express their respect to women more eloquently nowadays. So I think it also depends on the commitment in the family and in between the emotional connection between partners or husband and wives or whatever the status are. I think that also brings the difference.
Yeah, yeah. Yeah, I think yeah, ayah ASI it's like yeah, breastfeeding fathers. In Indonesia,
Father.
we have actually two association, yeah, for the mothers as well. We have the association for breastfeeding mother, and recently, I think it's not so long time ago, we already have the community of breastfeeding fathers, and they have the social media, they have kind of like the association, but maybe it's also only works in some part of Indonesia, especially in the big cities, but in the rural
Yes.
areas different stories again. So this is still a homework actually how to reach and also how to engage, like to involve the fathers more, especially in the rural area with the structured training and education. I think that's one of the issue as well. Okay, for the next question, I have this one. It's actually following up from our previous discussion as well about the role of grandmother. So, Smita Totkar asks, in many rural areas, elderly, family, and community members are viewed as experienced and wise in matters of childcare and breastfeeding, and their perspective are strongly shaped by gender roles. Instead of focusing intervention solely on mothers or fathers, have you considered involving these influential elders whose guidance is often taken seriously and could help drive more sustainable change? Yeah, this one. Dr. Arita, I think you're gonna start. Yeah.
Yes. Excellent question. Because I think we are facing similar situations when the maternal grandmothers or the mother-in-law are a significant co-founding factor in breastfeeding behaviors. But I think the same with Indonesia, especially in the rural Indonesia, the pattern is very similar. Mother-in-laws often want to protect. We see them as act of protections, protect the baby based on what worked in their generation. So rather than seeing this as a resistance, we see this as an opportunity. So we have more people to be involved in, especially grandmothers, and we can involve them early and invite them into counseling, give them updated information, and respect their role because I think most families are blessed to have grandmothers because they have more support and their influence becomes an asset, not a barrier. When we make a grandma a spokesperson of the family with accurate information, they can do wonders. Everybody will like bow down and then follow the instructions, right? So I think it's also important to share the updated information to them. And for families with very strong generational structures, from what we experience, breastfeeding succeeds most when we guide the whole decision-making unit. So not like only with one-on-one counseling and discussion. So not just the mother, not just the father, but also grandmother influence is real. So our approach must be family inclusive, culturally respectful, and build partnership, not confrontation.
Partnership, not confrontation. Another quote by Dr. Harita. I want to hear another viewpoint actually because Dr. Sarayon, Arita, and Jessie, we have almost a similar culture. Now I want to hear another viewpoint from Dr. Devon, maybe from the Western context. How it's gonna work? Like like the guidance of from the elderly, or like how does it work in Western context? Devon.
It's a tough question. The information I can give you is mostly anecdotal, I would say. But I think that this is, I guess, yes, I would say it is quite different in, say, the European or the North American context, in part because people have moved towards living much more in their nuclear families, maybe far away from these other elders who might be able to provide the support. And I think that this was a challenge that places like Sweden, the US, and Canada really faced in the second half of the 20th century. So in like the 1970s, breastfeeding rates were super low. And in part, this is likely because they lacked their support network there to kind of provide that advice and support around breastfeeding. So I'm not sure to what extent we can talk about elders providing correct or incorrect information or kind of information that supports exclusive breastfeeding. But I think what we can say is that when there is this lack of a support network, it seems to be more difficult for mothers to breastfeed as they like. And I guess that's why we've seen the rise of organizations that really target kind of supporting mothers and providing that peer support to mothers. And then we have subsequently seen this rise in breastfeeding rates in many European countries and in North America as well. So I guess that's a bit of like a side answer to your question, but I think the grandparents play a much smaller role.
Yeah. Exactly, because it's a different culture, and we mentioned before that this one part of the culture as well. And Indonesia, maybe Thailand, and maybe Kenya, we share like collectivist culture, while in the Western European American it's more like individualist. So it's different approach to when it comes to the support for the mother. Okay, so I see another question from Emmy. Emmy Lawrence Mukwana. And maybe this will be the last question for today because of our time is reaching the end. Looking at our government policies in regard to maternity and paternity leave, fathers are only offered 7 days. Would you recommend, in your own view, for equal time frameworks of leave for both? And also, has there been any documented evidence that those fathers who receive the leave actually effectively use it to benefit the mothers? That's really, really, really good question, actually. I want to give the chance to answer maybe from Sarayon from Thailand.
Okay. Right now in Thailand, good news is that we just have a new right for the father to be able to. It's just launched in the early of this month, November this year. The father are allowed to have a paid paternity leave for 15 days. Before, only the government officer should be allowed to have the paternity leave for 2 weeks, 15 days. But now we have the new law, so every father can ask for the paternity leave now, but it's only for 15 days. And let me give more information about the mother. Before, the mother are allowed to get the maternity leave for 90 days. With the new law, mother now can leave for 120 days. That's a good news. And for to answer your question, how many days should the father be with the mother? I think the most hectic period after postpartum period should be the first month. So I have heard that many other countries they allow father to leave for 1 to 3 months, but I think the first month should be a critical period for the mother because with the baby's problem, with they do not know how to handle with the baby. So yes, but
Yeah,
if
but
I can
sorry,
ask, I would ask for 3 months because after
3 months.
that, everything should be more stable after 3 months. All right. So that's my answer.
Thank you. One more answer from Jessie, maybe. Do you have any evidence that, you mentioned it's around 15 days in Thailand, but is there any documented evidence that mention that those time that the fathers have for paternity leave actually benefit mothers, or they use it to help the mother? So, Jessie,
Well,
please.
I've not come across any evidence. Maybe it's out there. But in Kenya, fathers get 2 weeks of paternity leave, and the mothers get 3 months. But different organizations, like for example, where I work, mothers get 6 months, fathers still get 2 weeks. But within those 2 weeks, we really don't know if they're supporting breastfeeding or they're hanging out with their friends. So I think if we do a lot of sensitization and training
Mhm.
when mothers come to the antenatal care clinic, that's a catchment point where we can actually train them that it's really important to give support, stay at home, help the mother with chores so the mother can rest. That can help to prolong breastfeeding. It can help to initiate and sustain breastfeeding practices. And it can also help just to, support the mother in all the mother is going through. As we mentioned at the beginning, it can be a very tiring process if there's no support. So if we can, educate fathers when they come to the antenatal clinic, I think from that point, then they're able to offer support during that period. But to be honest, 2 weeks is still quite short because after the 2 weeks are over, you're expected to go back to work. You're still, if you're offering support at night, waking up, you go back to work, you're so tired, you're not effective at work. But yeah, I think government policies should be changed so as to support breastfeeding. The other flip side is that men in informal settlements, really, in informal work, really do not get leave, and that's actually a barrier to offering support when it comes to breastfeeding.
Yeah. Okay.
Can I
Yeah.
jump
Thank
in
you.
super
Oh,
quickly?
just one really quick, Devon,
Super
because
quickly. And I think maybe Kika-san has actually put the paper in the chat. I'm not sure, but there is some evidence from Sweden that shows that when fathers and mothers are allowed to take leave at the same time, because often you can both take leave, but not at the same time. But when they're allowed to take leave at the same time, there is suggestive evidence that this does benefit the mother's health. So we don't know what it
yeah.
does to breastfeeding, but it benefits their health in Sweden.
Oh. So there is already the documented evidence on the benefit of maternity leave like that. Yeah. Okay. Thank you very much, Stefan. So with that, that's the end of our session today. Thank you very much for all the participants and all our panelists and keynote speakers today. So as we come to the end of our discussion today, I want to bring us back to the heart of this discussion. So breastfeeding is not a mother's responsibilities alone. I think that's the key point that we can agree on. And it requires supportive families, communities, and also system. And one of the strongest messages from today is this: when fathers are intentionally prepared and meaningfully involved, actually breastfeeding outcomes improve. Their support matters both emotionally, practically, and socially, and it can make a profound difference in a mother's breastfeeding journey. But before we close, I would like to express my deepest appreciation to Dr. Devon for the insightful keynote presentation, to our panelists, Dr. Areta, Mr. Jesse, Dr. Sarayon, for sharing valuable experiences from their regions, and to the LactaHub team and also the Global Health Network, University of Oxford, for jointly organizing this workshop, and to all of you, our participants, for your attention, your engagement, and your commitment to improving breastfeeding support around the world. We hope today's discussion inspires you to continue advocating for fathers' inclusive breastfeeding support in your communities and health system. And a quick reminder for those who wish to receive certificate of attendance, please complete the Global Health Network workshop feedback survey. Certificates will be issued only to participants who attended at least 80% of the workshop. You can access the survey at the link that you can show on the screen, and when you prompted, please enter the event title and also the code, and certificates will be emailed automatically to eligible participants within 1 month. And recording of this LactaHub workshop also will be available soon in lactahub.org webinars, and you can revisit the session and share it with colleagues or who might benefit from this session. So by that, thank you very much. Terima kasih, and we look forward to seeing you again at our next LactaHub event. Bye-bye.